ladies and gentlemen. On behalf of the Integrated Health and Wellbeing Council, I welcome all of you to this Kidney Care Talk Show, which is an initiative powered by RG Hospitals. I'm your host, Dr. Behjat, and today we'll be discussing about the transformative impact of robotic technology in urology, current applications, advances, and future frontiers. And to discuss about this very upcoming critical health issue, I have with me a very special guest. I welcome on behalf of the IHW Council, Dr. Susheel Kharbanda, who is a senior consultant urology at RG Stone Hospital, New Delhi. Welcome to the discussion, sir.
Yeah, good evening and thank you. Today we are going to discuss about robotics in urology.
In urology, right. So coming to the first basic question, Dr. Kharbanda, when we talk about robotic surgery, how is it different from traditional form of surgery? What are the major changes that have come up?
First of all, I would like to correct you. When we called it as a robotic surgery, it is always a robotic assisted surgery. What I mean to say, it's not, there's a public conception that in robotic surgery, robot is doing the surgery. It is not like that. It is just like a any laparoscopic surgery, where we put ports in the patient's abdomen and then we perform the surgery through those instruments. The basic difference between laparoscopic surgery and robotic surgery is robotic assisted surgery is the ports are put into the instruments are put into the abdomen and surgeon is sitting on the console. That means it's a computerized system where he is sitting and through that console he is operating. Difference between laparoscopic and robotic assisted is it is more precise. In laparoscopic, there is an assistant who is showing you cameras. He is assisting in other things, but in robotic assisted, you yourself you are managing your vision. Your vision is always three-dimensional vision, which is not there in laparoscopic, and the precision of robotic surgery is vast ahead than laparoscopic surgery. What always I say about robotic surgery is it is for when the things are not accessible. To make them accessible, we use robotic assisted. So when your precision is good, when your ergonomics is better, see, our hands can move in either in two directions, this and that. But in robotics, that instrument has a 7-degree rotation. So when to perform certain procedures, certain steps in surgery, when we are doing with our hands, it is not easy or it is not possible many times. But when we are using robotic arms, those procedures, those steps becomes very easy. And when the surgery is precise, the complications are going to less, blood loss is going to less, the pain to the patient will be less, and the ultimately goal, maybe patient stay in the hospital will be also less.
Right, Dr. Susheel. Very precisely, you have talked about the major differences in both of them. Then coming to the most common urological procedures that are currently performed using robotic assisted surgery, what would be those procedures?
See, when this, when this robotic assisted surgery was launched in way back in 2000, the first surgery it was promoted for was the radical prostatectomy. See, radical prostatectomy before that era was mostly was done by open or laparoscopic, and the difference was that at that time, I remember I was doing residency at that time. See, and robotic prostatectomy means you have to arrange around 4-5 units of bloods and all. So first surgery, which was for which robotic assisted assisted surgeries is that is one is radical prostatectomy and another are for surgery for kidney, like partial nephrectomy or radical nephrectomy. Then surgery for adrenal glands, maybe for oncosurgery, when there is a malignancies adrenal gland for removal of that, or maybe a benign tumor in an adrenal gland. Robotic surgery also we do for radical cystectomy, means the removal of our urinary bladder. Then nowadays, even renal transplant is also done by robotic, even donor and recipient both. So this is in very recent advancement in robotics. Now this is fully acceptable in the world. Robotic renal transplant, both donor and recipients.
Dr. Kharbanda, talking about, though you briefly touched upon how, when we are doing robotic assisted surgery, there is less pain, less, blood loss in patients. What other advantages, if you have to give in detail, does it offers over laparoscopic interventions?
See, when you want me to know about the advantages, so I will define advantages in two or three classes. So one advantage would be for surgeon. So in laparoscopic surgery, a surgeon is always standing, and his movements are not that steady, and it is very tiring for long surgery for around 4 5 hours. If he is standing and he has to concentrate, his vision is not good. And if you compare with the robotic, the surgeon is sitting on console, he is having a very nice vision, three-dimensional vision. And in between, because he is not dependent on his assistant for his vision and all. Otherwise, every time somebody is showing camera, if he is not very much into the surgery, he may go here and there. But yes, for these are the advantages for surgeon. His movements, as I said, they are 7 dimensional. In laparoscopic, they are just 4 dimensional. These are the advantages for the surgeon. So any surgery, if patient and the surgeon is not tired, so I think he can perform better for the patient also. These were the for the surgeon. Now coming on to the patient, as I already said, when your surgery is more precise, when your vision is so good, so your complications of surgery are going to be less. One, blood loss is going to be less, and recovery will be very fast. If I just give you an example of radical prostatectomy, when it was done open and laparoscopy as compared to robotic, see, at the present, there are hardly any incontinence after robotic prostatectomy, which was very common before. As I said, we used to transfuse around 3 to 4 units of blood in every robotic radical prostatectomy in open or laparoscopic. Now we give any transfusion that the blood loss is around 100 to 400 of ml in any radical robotic prostatectomy as compared to laparoscopic and that. So, and when these complications are less, your incontinence is less, your bleeding is less, hospital stay is less, your pain component is less, your hospital stay is less, you can join to your office or work soon. So these are the advantages for the patient.
Right, Dr. Kharbanda. Coming to recent advancements or refinements in robotic assisted surgical processes, what are some of the technologies which have recently, enhanced their utility when we talk of urological procedures?
So as I said, this robotic surgery started in 2000. So after that, there is so many refinements in, if you say, in vision. Previously, cameras were not good. Now, so if you if you compare from 2000 to now, the type of vision is better. Type of instruments are very vigorous. Their ergonomics has improved. They have become very steady. And if you ask me other changes, like now, so initially we have a limited number of instruments for robotic assisted surgery. Now we have very numerous instruments which are used for robotic surgery. Even, and if you say recently, what we have found now for radical cystectomy in which we remove the urinary bladder after cancer surgery. We use our intestine, food intestine, to make a new bladder. When this initially we were doing radical cystectomy with robotic surgery, but for making new bladder and ileal conduit, we were using open surgery. But now, recently, now robotic these staplers and other instruments have come, so that intracorporeal, that means without opening that patient, we are making a new bladder and all. As I said previously, now this robotic kidney transplant is also being performed, because we have now miniaturization of robotic instruments also, which can through which we can anastomose vascular to vascular anastomosis. So these are the recent advances. Now, initially it was done for a very few procedures. Now we are just making whatsoever procedures can be done laparoscopically. It is now being done by robotic surgery.
Dr. Susheel. So when we talk about assessing a patient's suitability for robotic assisted surgery, so what are factors such as anatomy, pathology, comorbidities? Do you consider these factors? What are the considering factors there?
This is a good question, actually. See, in my opinion, any patient who is fit for laparoscopic surgery, he is absolutely fit for robotic surgery also. There is no difference at all. Even because when you are doing a robotic surgery, time taken is less. So even if you are considering this patient may be not fit because surgery is going to take much time, those patients also have become fit for this robotic surgery. Yes, about pathological. See, when the disease is advanced. For example, I give you for this renal cell carcinoma, cancer of kidney. When this renal cell carcinoma has advanced into the big veins like IVC and all, in that case, we might have to open heart, big vein, vena cava, or our big artery, that is aorta. Those cases are not possible with robotic assisted, because we need to control our heart also. So there are very few surgeries where the disease is very advanced, or one for surgeries where you want to use tactile sensation. So many people say, what else is left in robotic, or what is lacking in robotic is tactile sensation. Tactile sensation you can't palpate. So this is the only drawback of robotic surgery. You can't palpate. So any surgery we use, when we think we are lacking that, we will be using that tactile sensation. On that case, this robotic surgery is not performed. But otherwise, whatsoever surgery which can be performed by laparoscopic is totally can be done by robotic assisted surgery also.
Apart from Dr. Kharbanda, you've talked about how in some cases where the disease has progressed, it doesn't work. Then, of course, talking about tactile sensations, what are some of the other challenges that you, or limitations associated with robotic assisted surgery that you can think of?
So, because as I already talked, ergonomics and everything is being so much improved. But what I said, what we are lacking before, we were not having any staplers, intestine staplers. There are some other harmonics and other things were lacking in robotics. But nowadays, every robotic company has come up with these vascular instruments and all. Because of those instruments, now we are. But if you're talking about around 5-7 years back, partial nephrectomy was not possible with robotic. Now, having with this vascular clamps and all, now we do partial nephrectomies with robotics and all. So slowly, these things because they know what we want. Okay, so there are so many new instruments have come into the market. Now, I don't think there is anything we are lacking at present. Yes, of course, there are certain things which are lacking, but at present, whatsoever surgery we were performing with laparoscopically, now we are doing it with this robotic assisted only.
Kharbanda, coming to the importance of, integrating emerging technologies such as augmented reality or artificial intelligence, how is that going to impact robotic assisted urological surgery in the near future? What can you see in the future?
See, this is future. Artificial intelligence and machine learning is the future. Even in medicine, even in surgery. Uh, uh, See, I don't know where we are going in this thing, but I am pretty sure with artificial intelligence, there are so many algorithm artificial intelligence and machine learning can use. Uh, so that in near future we might be seeing telementoring, telesurgery, or autonomous robotic surgeries also. Telementoring means you are sitting in the this part of the world and you might be operating that the patient might be operating in some other country. So that is one thing, and another that is telesurgery. Or you maybe you can mentor also. So if there's any urologist or any surgeon who is not that compatible, in not used to this type of surgery, anybody can sitting in this country can assist him on that country. So he can mentor him. This is the future one. And with artificial intelligence and machine learning, now thing is ki, after seeing so many algorithms, so many videos, you can put it into that system. So many data you can put into the system. But I don't think it will be very far that there will be autonomous robots. What I mean to say by autonomous robots means they will be performing a part of surgery by their own. That means you are not doing, that robot is performing. But I don't think they are going to do the complete surgery, because human thing is always required when you are treating patient. But a certain part of that procedure can be performed autonomously if you feed them. One. Second thing, with artificial intelligence and machine learning, if you feed them with so many data, when you are this is going to come in very future. That is, when you are performing a surgery, if you put at all the data, whole patient CT scan, MRIs, and every reports, when you are performing surgery, that robot can assist you. Assist you means he can say if you are stuck up somewhere, so he can just give you some ideas. Okay, so you can do like this. Or when you are cutting something, you should not be cutting. So with that data, he can just stop you from doing that. So is going to come in very near future. So artificial intelligence and machine learning will be the part of our medical surgery.
So other than machine learning, artificial intelligence, how technology is being integrated, what other research areas you feel can give a very brighter future as far as robotic assisted urological interventions are concerned?
See, I think already spoken artificial intelligence and this thing. Again, the tele robot, this tele mentoring and tele surgery, and now another new thing which will be going to come, that will be nano robotics. Nano robotics and micro robotics. See, this will be very tiny robots, tiny. This will be actually, these robots won't be visible by your eyes and all. They will be so tiny. They will be working at the level of cellular and molecules level. So just with that, they will be very tiny robots. You just have to inject into the body, and they will go to specific area where they can deliver the chemotherapy or any other therapy there, and they might be killing that our cancer cells and all. So this is the recent advances which are going on, and I don't think in very far, very it won't be very far. We will seeing all this thing in common practice also.
Right, Dr. Kharbanda, coming to robotic assisted surgery, there are in India, especially, we have a lot of myths and misinformation as far as health is concerned. So, like, and the initial part of the conversation, you pointed out that how people might think that a robot will perform the surgery, though he'll just assist the surgeon.
Yes.
What are some of the other myths that you have seen in your practice, people, because it's a new and growing field, people might have, apprehensions about that. And so what are some myths that you would want to clarify through this talk session and this channel that people
So,
might have?
see, the first thing, as I always already told you, people think some robot is doing the surgery. Actually, which is not. It is a surgeon who is doing the surgery. Second myth is it is not very affordable. In India, now there are different companies have come up and which have reduced the cost of robotic surgery drastically. Okay, and only the another thing is the people think it will be a very yeah, huge things. There will be a huge machines and all which we put into your body. And another thing is when you surgeon will won't be hanging any control over the robot. Anything can go wrong. See, something has happened in cardio by robotic. It was published in some paper also. So people come to me, see, we have read that something went wrong and surgeon was outside. See, I told him, see, it is not like that. Surgeon has always have control over robot, and they are very specialized machine. It is not that they can work. Even I was saying when you are sitting on the console, if you are performing, and between if you just come out of that console, that robot will stop. So that means everything is in your control. If you are not saying, that means that robot is not going to work. So that is has to be clear about the cost. See, say now in almost, if you compare between laparoscopic and robotic, the cost is maybe extra cost of robotics has come down to around 60,000, 70,000 plus what we are charging for that. These are the myths I would like to clear to the patients.
Right, Dr. Kharbanda. You talked about from a patient perspective how robotic assisted surgery can, give them very convenient options, like the stay in hospital is also less, and of course blood loss is also. What about once you because once the laparoscopic surgery is done, you have to come back for your medication, your course. What is the difference when we talk about robotic assisted surgery? Once they are out of the hospital, is there a difference? How does that go?
So I don't think in that case there will be any difference. See, only thing is he will be having less complications, less pain, so they won't be requiring much pain relieving medications and all. But yes, post-operative visits, it is same, Say if either it is because any surgery it's just a how we are performing that is different, but his post-surgery treatment is going to be same. It is not altered by what procedures you have done. But if you compare with open one, of course, see open one, there is a large wound on your abdomen. You have to come visit very early and all. You have to come for suture removal and all. So there can be infection in your this thing, and your hospital stay is already more than when you are doing robotic surgery.
Right, Dr. Kharbanda. Any other point that you think we have missed during the course of the conversation and you would want to focus on that as far as robotic assisted surgery for urological, interventions is concerned, if you would want to focus on that?
I think we have fairly covered everything. But only thing, but I just want to say it is affordable. It is doable, and it is not that it will require a very high skills and all. Of course, urologist should be compatible to do any kind of surgery. But if it is fairly compatible, so its skills are enhanced when we are using robotics and all. One. And another thing is when if you have a possibility, when you have a chance to give better results with less complications, less hospital stay, of course, you should go for that.
Dr. Kharbanda, but before we call it a day, when we talk about prevention is better than cure. So if you had to give 5 tips to people to maintain their, health and to keep a tab on mental and physical well-being, what would be those 5 tips?
See, I think everybody knows about it. See, healthy food, that is most important. Don't chip every time have this and that. Do the regular exercises. Avoid drinking, smoking, all bad habits you have to stay. Avoid animal fat and all as less as it should be possible. Healthy diet, exercises, and most important is you should always go for your preventive health checkups. See, after certain age, you should always do your all preventive health checkups. So many times there are so many diseases which can be caught on your routine health checkups. Otherwise, you will find out at a stage where they are non-curable. For example, why prostatic cancer is increasing. Initially, when I was doing my residency, most of the prostate cancer were found at the metastasis. That means that they are already spread into the body. We were not able to do anything. But now people are more aware about this thing. So they go for routine health checkup and all, and they do PSA also. Through PSA, they found that there are chances of any malignancy. This is just a example. This is same for cardiac patients also. When you do your routine checkup, when they found that your lipids and everything is something is high, so at that stage you either you take some medications or take some professional help, so that your ahead life can be better.
Dr. Kharbanda, that indeed was a very, very insightful discussion, and thanks for taking out time from your very busy schedule and joining us for this awareness session. And I'm sure our audience today will take up a lot of relevant information on the various aspects of robotic assisted technology and surgery in urology. Thanks for being a part of this information exchange session, and thank you for being there. To all our audience, thanks for joining us, and you can just keep on following our social media pages for more updated information on health and well-being. Thank you, sir. Thanks for joining.
Thank you. Thanks a lot.